Hello there. I'm Dr. Lipi Roy, and welcome to my show, Health, Humor, and Harmony. So, what do Khloe Kardashian, Bob Marley, and Andy Cohen all have in common? They were all diagnosed with and successfully treated for melanoma. Today is Melanoma Monday, an awareness campaign held on the first Monday in May, which is National Melanoma Month. The American Academy of Dermatology set aside this day to raise awareness about skin cancer. First off, what is melanoma? According to the American Cancer Society, melanoma is a type of skin cancer that develops when melanocytes grow out of control. Melanocytes are cells that produce the pigment melanin, which provides color to skin, hair, and eyes. Melanoma is much less common than basal cell or squamous cell cancers, but it's considered far more dangerous because it's much more likely to spread to other parts of the body if it isn't caught and treated early. So, how common is skin cancer? Turns out that skin cancer is by far the most common cancer in the United States. The American Academy of Dermatology estimates that 9,500 people in the US are diagnosed with skin cancer every day, and that 1 in 5 Americans will develop skin cancer in their lifetime. Melanoma makes up about 1% of skin cancers, but accounts for 75% of all skin cancer deaths. So, what are the risk factors for getting melanoma? The most common risk factor is exposure to ultraviolet or UV radiation from the sun or indoor tanning beds. Sunburns during childhood or adolescence can also increase the odds of developing melanoma later in life. Risk factors for all skin cancers include skin that burns easily, blonde or red hair, a history of sun exposure, a weakened immune system, a personal or family history of skin cancer, and having over 50 moles, large moles, or atypical or suspicious looking moles. So, who gets melanoma? It's 20 times more common in white versus black Americans. Melanoma is also more common in men overall, but before age 50, the rates are higher in women versus men. The risk of melanoma increases with age. While the average age of diagnosis is 65, it's not uncommon among people younger than 30. In fact, it's one of the most common cancers in young adults. Reggae legend Bob Marley sadly died of metastatic melanoma at age 36. Early detection is key. The earlier melanoma is diagnosed, the more likely it is to be cured. The American Cancer Society advises us to know our own skin, recognize patterns of freckles, moles, blemishes, and other marks on your skin. If you do find a mole, follow the ABCDE rule. A is for asymmetry, one half looks different from the other half. B is for irregular border. C is for varying color. D is for diameter, usually more than 6 millimeters. And E is for evolving or changing in size, color, or shape. If you notice any of these elements, make an appointment to see a dermatologist right away. How can melanoma be prevented? The most important prevention strategy is reducing your exposure to harmful UV rays. Here are 5 key tips from the American Academy of Dermatology. 1. Find shade, especially when outdoors from 10 a.m. to 2 p.m. when the sun's rays are the strongest. Second, wear sun protective clothing such as long sleeve shirts, pants, a wide brimmed hat, and sunglasses with UV protection. 3. Use water resistant sunscreen with an SPF of 30 or higher. 4. Avoid tanning beds. And then 5. Be cautious near water, snow, and sand because they reflect and intensify the sun's damaging rays and in turn elevate your risk of sunburn. So, what are the treatment options for melanoma? The good news is that when detected in its earliest stages, melanoma is highly treatable. If detected and treated before spreading to the lymph nodes, the average 5-year survival rate is 99%. However, the 5-year survival rates with regional and distant metastasis or spread drops to 68 and 30% respectively. The primary treatment strategy for most melanomas is surgery, including wide excision, Mohs surgery, and in rare situations, amputation if the melanoma affects a finger or a toe. Non surgical treatment options include chemo, radiation therapy, targeted, and immunotherapies. So, what can you do to help? You can spread the word on melanoma screening and prevention with your family, friends, and loved ones. You can host a fundraising event, or you can donate to any number of incredible organizations such as the American Cancer Society, the Skin Cancer Foundation, the Melanoma Research Alliance, and the Melanoma Research Foundation. Well, that's all for today, folks. And here's the joke of the day to start your week off right. Why didn't the chicken go to school on Monday? It was feeling exhausted. Tune in for Women's Health Wednesday, this Wednesday, 3 p.m. Eastern, when I'll be talking about osteoporosis. And be sure to subscribe to my YouTube channel and follow me on Instagram at Health Humor Harmony, Dr. Roy. Be well. I'll see you soon.